right. Welcome, everybody. Give folks a minute to trickle in. All right. Well, let's go ahead and kick off. We're here at 1:30 on the dot, and we got a passionate panel here with lots to talk about. So I want to make sure we have every minute available. Welcome, everybody, to the Digital Healthcare Innovations panel. We will be talking today largely about telehealth, but also other remote and virtual technologies that have come to light during COVID, as well as where we think they're headed. I'm joined by a very esteemed panel. I've had the pleasure of not only moderating panels with many of these folks, but also hearing them speak in the community. Very esteemed, very accomplished, and most importantly, very passionate about health, healthcare, and technology. I'm joined here by Julie Bonello, CIO, President of Presbyterian Healthcare Services, Roy Suku, CIO of UNM Health Sciences Center, which encompasses a number of the UNM facilities, Michael Herrick, President of Matterform, and Peter Ames, CIO of the Loveless Health System. So as you can see, a lot of healthcare organizations, as well as healthcare technology vendors here. My name is Stephanie Garadia. I'm the Vice President of Health Analytics at RS21, and I'll be moderating our panel today. So I want to start out and set the stage. I'm going to ask each of our panelists to give a little brief, 3 to 5 minute background about their role, and more importantly, what they've observed, what they've seen, what they've done over the last year as it pertains to COVID, remote technologies, and any other technology initiatives in their organization. So we'll start there, and then we'll tee up some questions. So I'll hand it over to Julie first.
Thanks, Stephanie. I would characterize, I'll just jump right in, assuming we all know, being in healthcare, we have been kind of on the front lines of telehealth since COVID. As Stephanie mentioned, 2019 was the year that we jumped into it and to provide services where services didn't really exist because all of our providers were on the front lines. So it was chaos, and our workflows weren't defined, and our technologies, everything was not sustainable. So I would characterize 2020 as the year of moving to sustainability from an office visit perspective and really providing telehealth services. We really looked at patient sustainability services in terms of providing a technology check, providing better workflows for checking into your telehealth visit, and the other, really thinking about the workflow for the patient. And then the other piece was thinking about the workflow for our care team. So adapting our clinics and our workstations to support a telehealth experience for our providers that really worked in providing care to our patients. That was key. Providing better workflows so it wasn't taking double time for our providers so they could care for more patients. So we're doing a lot of those workflow optimizations and then making sure we've got billing corrected. The other piece for us, because we're an integrated delivery network, when we think about delivering telehealth services, we're not only thinking about the strategy for patients, but for our members too. So when we look at providing a more immediate access to services, it can be done also through our plan in addition to our delivery system. So we have spent a lot of time in thinking about how that can be both delivered to our insurance plan members and also streamlined for them in terms of access. The other piece, and I'll try to be, I don't want to take more than 5 minutes. I would say the next piece of sustainability is extending services now. So extending specialty consults, extending from our central delivery system to our rural system in terms of cardiology, palliative care, behavioral health. And again, we may look at different areas of benefit for our insurance members than we will for our delivery as well. So we keep that in check and try to make it as integrated as possible. And then the last piece that I would say in terms of sustainability is one of the things that COVID really hit. This is, as everyone has characterized, the Great Resignation. We have a shortage of providers and nurses nationwide, both primary care and specialty care. So that really hit us in the state. And so when we think about providing telehealth services now, we're often doing it to provide a gap in our network of providers that we need in order to take care of our patients statewide. That means that we're going to now start to partner with different telehealth services that not only provide a technology platform, but they're actually providing the providers as well, and allows us to fill a gap to ensure that we can provide the necessary continuum of services that our patients need.
Great. Yes. And for those of you who don't know, when COVID hit in around March 2020, we saw telehealth, which is care that could be delivered virtually, either over telephone or video visits, either synchronously or asynchronously. We saw that jump from less than 1% of overall healthcare visits. It jumped by about 8,000% to, in New Mexico here, it was around 17% shortly after COVID hit. So a lot of rapid response going on, and a lot of I'll just leave it at that. Rapid response. We'll talk a little bit about what that means. From there, I'd like to go over to Roy from UNM.
Thank you. I'm the Chief Information Officer for the Health Sciences Center at University of New Mexico. But I'm new to University of New Mexico, so I'll share my experiences elsewhere. I've started telehealth back in 2014 when it was a spoke and hub model, right? We bring the patient in to a clinic and we connect them to a main campus or to specialty services. And also, we also used telehealth back then in 2014 for primary care physicians to get consultation from specialties, right? And then we kind of dabble a little bit about the virtual urgent care. Well, fast forward to April or March of 2020, telehealth is everywhere in every nook and cranny of healthcare. In fact, I read only this morning that in 2020, this space is about $80 billion and will balloon in the next 7 years to 2027 to $396 billion. So telehealth is here to stay. And in our conversation, I want to kind of set the tone now that not all telehealth solutions are created equally. And maybe we can talk more about that in our conversation. So I'll leave it there and we'll.
Great. So it sounds like UNM may have been some of the earlier adopters of telehealth technologies, and now it's just taken off. Excellent. Michael, I'm going to come back to you. I want to get all the health systems wrapped up, and then we'll have Michael round it out. So if you don't mind, Peter.
Peter Ames, I'm CIO for Loveless, which is part of Ardent Health Services. And so yeah, my first day at Loveless was March 16th of 2020.
That was the Monday Monday of the lockdown.
That was the first day of COVID protocols. And I will say, Julie, you were a great mentor to me over at Press, and I tried to take some of the things I learned from you and your team over to Loveless, and it came in handy. So I wanted to thank you for that. Yeah, so I was scheduled to meet with Ron Stern at 8 o'clock that morning. I got a phone call. Ron won't be meeting with you today. So I've been kind of winging it since then, but I think we've done a pretty good job. So, I think about certainly telehealth, telemedicine is what was once considered perhaps a convenience is now a necessity. And so the ability to have those platforms in place initially and then be able to scale them is really kind of what we accomplish there. So we are certainly offering all of the services around virtual care, async, synchronous, telemedicine, consults between providers, for example, the ability to extend a specialist into a rural community is very important. Be able to spin up those those encounters in real time. So that all requires robust broadband, right? It requires robust broadband in our communities, in our rural areas, because all of this telemedicine, telehealth is great, but if you don't have the ability to access it, then you know that could be a barrier that we need to work on here in New Mexico. But you know, I think about all of the underpinning systems, subsystems that it takes to run a hospital, and I think during COVID, some of these that you know kind of took for granted, all of a sudden, you know, that story of want of a nail, for example. You know, if a sensor in a pharmacy fridge isn't reporting back, and you know that goes out, and you have to you know dispose of an allotment of vaccine because of a stupid little sensor going on. I mean, these kind of things became very important all of a sudden, right? Or the ability to maintain patient flow from, you know, from the ED into the ICU, for example. A zebra printer goes out. What's a zebra printer? Well, it prints the bands that the patient needs to be able to scan meds and everything else, and it's part of that patient flow. So I will get them a zebra printer. Well, we can't, boss, because you know the supply chain, they're all on back order. And like, you know, all of these things that came up and that continue to be part of that. And as Julie mentioned, the nursing shortage today is really taking its toll on us, right? So, you know, I think, Michael, you mentioned, hey, Peter, you're going to be speaking to the Tech Council, and you got to talk about, you know, blockchain and IoT and AI and ML. I'm like, yeah, but my phone's not going to blow up today because I'm behind on my blockchain project. It's going to blow up because I got a bus of 22 traveling nurses at the front door, and they need to be credentialed, access provided, trained, and badging, and be on the floor by noon. I'm like, okay, we'll get that done. It takes an IT team to be able to do that. So I think that what COVID has taught us is that, you know, all of these function points within a healthcare system are stressed, and it's a very interesting times right now. So I'll just kind of leave it at that.
Thank you.
Yeah.
Michael?
Yeah, interesting times. May you live in interesting times, they say. Stephanie, thanks for moderating us, and it's great to be here. I'm just happy to be out of the house. So thanks everybody for coming. It's great to see everybody. So yeah, my name is Michael. I'm with Matterform here in town, and my experience is a little bit different. I'm a health technology entrepreneur, so I work with a lot of different health companies and health technology companies. I work with some startups and some more, and also some clinics and FQHCs in the healthcare space. So at my company Matterform, our primary work is in HIPAA compliance and cybersecurity consulting. So in that capacity, we've been working with a lot of healthcare organizations here in New Mexico, a lot of FQHCs and smaller, and including some rural healthcare organizations with their telehealth initiatives, helping them and especially helping them evaluate the security ramifications of what they're trying to do. A lot of companies are having to open up and really shift to a very different kind of security model. For so long in healthcare, we've had this castle and moat security model. Just everything happens inside the healthcare campus, and we focus on keeping the bad actors outside. Well, now everybody's every place. We don't even have a work from home environment. We have a work from anywhere environment. How do we transition to a security model that supports that, continues to protect patient data, giving access to the patients, but then protecting that data? It's been a real challenge. It's been a challenge. We've seen a lot of challenges with particularly, as I said, with the smaller organizations, with the rural organizations. They're the ones who more than anybody need to be able to provide telehealth solutions, and they don't have the resources of the Lovelace, the UNM, and the press. So that's been an interesting challenge that we've been working on with our clients there. I'm also a CTO of a Mexico startup called MediCheck, where we are the leading EHR software provider in Latin America, and that's given me a whole new perspective and a global perspective on this global pandemic. There have been a couple of major innovation initiatives that we've launched at MediCheck. First was fully integrated telemedicine services into our EHR platform. So we've learned a lot about how do these tools have to work, and what's the user experience got to be in order to drive adoption, particularly in a market like Mexico, where all of this stuff is brand new. In some ways, that makes our job harder. In other ways, it makes our job easier. We're kind of starting from scratch. We don't have a lot of legacy technology that we need to be compatible with. We get to build it with current standards and leverage technologies that are available now that weren't available 5 years ago. So on the one hand, we're very nimble and we're able to move very quickly, but it brings its own challenges at an emerging market like Mexico. Another major initiative was a new product that we launched called Healthy Workplace, which we very early in the pandemic, we realized that there was a need to bring healthcare not basically outside of the clinic environment and into the workplace environment. So a number of our biggest clients now in Latin America are, yes, we have hospitals, yes, we have clinics, but now we have factories. We have industries who are providing healthcare to their employees, who are monitoring their employees' health to ensure that they're not shut down due to a super spreader event inside the factory. So being able to monitor employee health, track employee health, and to do it with the types of healthcare technology tools that hospitals have been using for years. We've got to bring that kind of capability into the market as a whole, into other industries as well. So that's been very interesting, seeing how healthcare is starting to bleed across those boundaries as a result of this pandemic.
Well, Michael, are you bringing HIPAA compliance down to Latin America?
We absolutely are. I mean, HIPAA is a U.S. law, but it's an international standard. And hospital administrators in Mexico will ask us, "Are you HIPAA compliant?" They will literally, and they will use those words. So yeah, absolutely.
I actually thought you were going to say heck no. Great. Well, thank you all very much. That was really insightful. So we talked a little bit about what you've observed and really what you did in rapid response to COVID. So what I want to shift a little bit to is what you're now observing and how it's shaping your future strategy now that we have time to kind of sit back a little bit and think about it critically and plan more strategically going forward. So I'm really interested in, Julie, we'll start with you. So uptake has varied depending on various things, patient experience, providers have varied on adoption and their regard for telehealth. So I think, while we all think it sounds great, and yeah, I would love to get my care virtually, there's still a lot of, real pushback and just differing results that we're hearing. So Julie, I'm curious what you've heard both from your providers and also what you're hearing from your patients as well.
Well, I think in order for telehealth services and digital services to be successful in healthcare, I'm going to actually make it a broader. We're really talking about digital transformation. We're talking about changing the way we deliver healthcare. And so what that means is we are changing our clinical delivery model, right? And that's transformative. And when you do something that's transformative, you're changing the way you operate, you're changing the way you define jobs, you're changing the way you get paid. And so technology, while COVID really brought this to the forefront, we are not driving it, but we are supporting it. And to come up for all of our organizations in healthcare, to come up with a strategy for really how you do that now, defining very clear workflows. In the hospital, we have very clear operating models, right? And we are certified by the Joint Commission. So these are tried and true, zero defect, should be, hopefully, zero defect processes. But now what we're doing as we provide more telehealth services, and actually we now will go into the home and at Presbyterian, we've got hospital in the home, right? So we've been a leader in that regard. But as we talk about how to leverage technology, really it's that clinical redesign that we're talking about. And you can only be successful in leveraging technology in support of our providers and then our patients if you really do the redesign and then know how technology can be leveraged successfully. It's a whole new way of thinking. It's a whole new way of planning. It's a whole new way of implementing, maintaining, and it's a change in your workforce. So it is something that all of our organizations have to sit back and say, what's our methodology? How are we organizing? And really starting to put that roadmap together. So I would say that that's the imperative that we see in front of us right now. And we can't make our roadmaps 5 years. We have to really do it now. We have to think about things that we can do immediately over the next year, because we've got many, many threats to upset healthcare delivery in ways that we have not been expecting up until now, which we'll probably get into in a little bit.
Yeah, very interesting. I want to touch a little bit, Roy, on something that you said about the technology enablers of telehealth. And you mentioned during your intro that not all vendors are created the same. And I think a lot of that can influence some of the things that Julie's talking about, uptake and adoption and strategy. So I'm curious if you could speak a little bit to what you meant when you said that not all telehealth
Sure.
vendors are made the same. And then in your opinion, based on what you've seen across all of your UNM organizations, where do you think telehealth fell short during the pandemic? And where do we have opportunity to improve?
Yeah, sure. Thank you, Stephanie. I think I bring a unique perspective because I've been with 3 healthcare systems during the pandemic. There are 2 kinds of healthcare system. One that had telehealth already installed, integrated with their EMR, ready to go. And then COVID just kicked them into high gear and off and running, right? The other healthcare system, they were just thinking about it, talking about it, have a 5-year plan on it, and never really got anywhere. And so when COVID hit, they used a Band-Aid solution, FaceTime, Google Meets, and whatever else they can. And that will end up happening, frustrating the providers, frustrating the patients, and really not a good experience. And I think in those organizations, you'll probably end up seeing a decline in telehealth services because it just wasn't adopted well. I think the idea is we need the healthcare system to be successful, need to seamlessly integrate telehealth into the clinical delivery strategy and workflow. And if it's not that way, then the patient experience is not going to be good. So the patient experience is critical. Clinical outcomes is also important. And I've worked with both types of organization, one that really were prepared and ready to go, and ones that aren't. I worked for one organization in the city, New York City. They took advantage of the crisis, and they brought up telehealth and mobility solution in 2 weeks, when it normally takes 9 months in the procurement process. So there's an organization who didn't let a crisis go to waste, but actually and did a very nice job implementing a telehealth solution into the EMR and integrate that into the workflow. But to take it one step further, we need to really broaden the digital front door of healthcare. And organizations who are doing that well, what they're doing is they're integrating e-triage and with telehealth. And what that does, that provides the consumer or the patient with easy access to healthcare whenever they need it, with the most convenient way of accessing it. Whatever's convenient for them, that's what they're going to use. And that's what telehealth provides them. And also a reduced cost, right? Because now we're keeping patients out of the emergency room, hospitals, and really it's a win-win experience. So I think as we're leaving out of COVID, I think we're going to see some organization being very successful. There's going to be an uptick in telehealth, and some organization will see a decline. And we're seeing that already, right, in telehealth services. And so Fortunately for us, though, there are a lot of money. Like I said, I think there are going to be about $396 billion in the system to move this along, and it's not going away. I think that healthcare systems who are neglecting telehealth, who think it's going to pass, will be disrupted in a very, and they'll be, it's like Netflix disrupting Blockbuster, or the steel mills getting disrupted by the mini mills. I think we're going to see some dramatic changes in the next couple of years. And I'm excited to kind of watch that unfold. I don't know if I'll be around to see it through, but we'll see how it goes.
I just, thanks, Roy. I mean, I think, we work in this industry every single day. So just to level set, telehealth is here to stay without question. And our foundation EHR systems, they vary a little bit in terms of their ability to support telehealth, but in general, they support it. I know from the system that that Presbyterian uses and Loveless, we can just be honest in terms of the names, Epic, they're very, very good in terms of providing full capabilities and integration opportunities for all the both within the product to support a very seamless access of telehealth services and the ability then to integrate with additional capabilities, whether we're implementing diagnostic capabilities in the home with TytoCare like we're doing. So, but it's here to stay, you guys. CMS just 2 days ago continued all of the telehealth reimbursement policies that they did under COVID-19. What does that do? It says that they're going to continue to reimburse for all the kind of telehealth services that they did, and that they're going to relax the credentialing for providers, right? And so those have been the two biggest stumbling blocks. And I think you're just going to see it after this year, when things are more figured out in terms of those, you're going to see a continued support for more and more telehealth services. For example, there are weird things like you had to have a primary care provider had to see someone 6 months prior to having a telehealth visit. Not now, right? I don't think you'll ever see that again. And so just from a foundational standpoint, this is where healthcare is going to go. And it's actually going to get broader and broader because you're going to be able to get telehealth services from outside the state, right? We're all going to be partnering with different organizations to provide additional services, and they're all going to be integrated with our EHR. So just wanted to give you, in terms of telehealth, kind of that regulatory landscape from CMS.
That's very helpful. I think we have been hearing mixed accounts of people if they think telehealth is going to stay or if it's going to start dwindling as well. So what I'm hearing is it's here to stay, but there's a lot of foundational things that we're going to have to definitely rethink. Okay, well, along those lines, I'd like to turn to Peter and ask I want to talk a little bit about patient experience. And I know Loveless is always very patient experience forward. So in your opinion, Peter, what have you seen? Did telehealth hit the mark on what patients are expecting or wanting? And if not, why? And, what are some of the things that we're thinking about as we go forward to maybe improve some of that patient experience?
Okay, good. Give me the hard question.
Had to make sure you're awake.
Yeah, I'm awake. So my thought on all this is that, if an organization is only providing in-person only care, for example, for virtual primary care, virtual urgent care, or chronic disease care, if you're only offering that in person, then you're excluding the people that need it the most, right? So who needs it the most? Well, it's perhaps a single parent that will have to drive to the doctor's office, that will have to take time off from work, that will have to, spend the money for gas, all of the, probably childcare, all of these things to get to their appointment, which could be depending on the proximity of the office, and spend a half a day perhaps for a 7-minute encounter, right? And so, and as Julie mentioned, it's these inherent telemedicine, telehealth capabilities within our EHR that are providing that capability. But at the beginning of COVID, it wasn't there. So as Roy mentioned, we were using FaceTime, we were using whatever you had, right, to get spun up on a session. And then of course, then how do you, we got to pay for that session somehow. So how do you drop charges into Epic? Well, so yeah, there's been this kind of, we're getting better as we go with it. But I think that, well, I'll ask Rick Aguilar sitting in the front there.
Honorary panel member?
No, Rick sent me a text a few months ago. Peter, why is your urgent care closed? Well, so I asked Rick, how did that go? He goes, well, I went home and got on a virtual care session and we got it done, right? You got your script, so I think it's this adoption of, let's think of that first perhaps, right? As opposed to driving to the urgent care and finding out it was closed.
Hey, Stephanie, it's not fair. Peter has a plant. It's not fair. He come prepared.
Right.
Peter will be giving everybody his cell phone number, so that if you have any issues with telemedicine
Heard it here first, folks.
at Loveless, you can get that same level of service. Everybody should have the CIO's mobile phone number.
So yes, the adoption rate, and I think, as we mentioned, providers and customer patients, they're all customers, right? That whole patient journey is we're going to get better as we go. The digital front door, how do you do a virtual check-in? You get your appointment, okay? Now you've got your diagnosis perhaps. Here's your aftercare treatment program. So we're going to send you home with some remote patient monitoring devices, right? So, you think about a cardiac implantable, for example, and now the provider has this dashboard of the health of the entire population of cardiac implantables, right? And if something is out of whack, out of parameter, we need to bring you in, right? So I think it's those type of things that, and oh, by the way, if you're a diabetes patient and you want to see your endocrinologist maybe once or twice a year, well, now with virtual care, it can be a more continuous process. And so I think that's going to, drive the better outcomes, lower the costs, and really provide better service to our patient and provider experience.
Yeah, I think it paints a picture of this more holistic view of health. So telehealth, being able to talk to somebody on the phone is one thing, or over video, but you mentioned remote patient monitoring devices and other, fitness tracking devices, as well as part of the future innovations that we might start now pairing with the telehealth to create more of a holistic view, which is some of the pushback that we hear from providers. They like to be in the room with the person. They can take their vitals. They can, see all these things happening real time. So that's very interesting.
Hey, Stephanie, as Peter was talking, I was thinking of the user experience. I think I don't drink coffee, but you can get a cup of coffee at a regular gas station and it's fine. But you can go to Starbucks and host the whole experience, right? So I think when we start talking about telehealth, you got to talk about a patient experience. I was a Kmart shopper or a Sears shopper till I met my wife, and she took me to Nordstrom. Now I always want to go to Nordstrom, so obviously I marry up, right? But it's the experience. And as a patient myself, during this COVID experience, I talking to physicians, cursing IT under their breath, or the patient has the laptop in one hand and the phone on the other hand, because the phone and the video didn't sync up together. There's no way in God's order they're going to go back and go for another virtual visit, right? But there's some experiences where I had an experience with my dietitian, and it was wonderful. And there's no reason I'm going to ever want to go back into her office again, because it makes no sense, right? And we lived on the East Coast. To Peter's point, it takes a whole day to get a 50-minute appointment with a physician, right? Traffic and subway and daycare and stuff like that. And when you go there, the physician sees you for 2 minutes, didn't even touch you, talk to you, and says, go pick up the prescription and the printer. And you go, really? So in that case, the virtual care was a much better experience, right? And I think it's going to be, and folks are demanding these experiences because they're used to the Southwest of the world. They're used to Disney of the world. And when they dial in, they go, hey, you better get on your A game because I expect it, you know. So.
Yeah. Wow.
If I could add one more thing real quick,
Absolutely.
Stephanie, I just thought about, the patient experience and the my chart, the applications that you have on your phone to access healthcare today. And now with interoperability and the blocking rule, the results of your lab tests are now instantly presented to your cell phone before your provider maybe has the chance to consult with you. So what you do, is you go to Dr. Google, right? And figure out, but that's what I did. When I got my path results, I was like, what does that mean? So I'm like, okay, I guess.
You need the CMO's phone number to text him
Yeah.
or her.
So, yeah,
Yeah.
gosh, we could probably
We
talk
could
for
go on for
hours.
hours.
I mean, I just like, oh boy, probably shouldn't talk more, but okay, when we talk about user experience right now, we're talking about a frame of reference of what we know to be the healthcare delivery system of today. Healthcare is going to be disrupted. It is currently undergoing disruption. In 2023, a consumer will be able to grant a third-party business access to the same information that Peter just mentioned that we now see in MyChart or any other portal. That means that will begin to grow what will become a huge market for a consumer medical record with capabilities that all of us will be able to control, with applications on chronic diseases that we can all control. So it's going to, the response, it's going to shift. Not that our electronic health records will still not be around within our health systems, but we're going to see a major shift, you guys. And we're already seeing new entrants to the healthcare delivery market, and they're going to be available to us in various ways because our benefit plans now will allow us to gain access to these capabilities that may not have been traditionally within our quote provider network, okay? So it's really going to change in a very significant way. So when I talked before about our health systems defining their digital transformation strategy, what I meant was they really need to talk about what healthcare delivery is going to mean for them in 5 years, in 3 years, and even 2 years, because their biggest differentiation is their tertiary and quaternary care resources, their inpatient resources. Everything else is periphery, right? We already have ambulatory surgery centers, right? We have a fragmentation of our healthcare system all over the place. It's going to continue. In a good sense, consumers will have access to a lot of capabilities now to really manage your own healthcare and your well-being. But when that happens in 2023, and Michael can talk about this, that data is now not governed under the traditional HIPAA laws that's governed by the Office of Civil Rights. It now moves over to consumer and the FTC. So when that happens, FTC has said you really should be adhering to all the same HIPAA standards, but who knows? We all, Equifax is governed under the FTC, okay? We know what happened then. So, I don't know if you want to, sorry, Stephanie.
Well, actually, that was the perfect tee up because I was about
And
to ask the exact same question. so.
And who's going to enforce that? And
Yeah.
what's the actual accountability going to be? I mean, I think the standards are clear. I mean, the HIPAA is pretty technology neutral, and you can apply the HIPAA standards at a coffee shop. In fact, you should. As far as the security standards go. So yeah, that's really the expectation. That's the expectation we are dealing with, for example, in Mexico. That's also the expectation my clients have who are in health-related fields, but are not technically HIPAA-covered entities. people who may be doing wellness type of information, or people who are giving that kind of power to the patients, where the patients, where the patients are giving authorization to get this information or are submitting this information. The patients still expect that this is protected the same way that your healthcare information is protected at any healthcare organization. And they're sometimes shocked when it's not. If you remember, there was a fitness tracker who had a healthcare breach and people were appalled. And the answer from the manufacturer of that fitness device was, well, it's not HIPAA, so it doesn't matter. We're not under that. So quit complaining. That didn't work. People didn't say, oh, okay. Then I guess it's okay that you showed the world where I jog every morning. Things like that. I guess it's okay that you shared all my vitals with the dark web. They didn't say that. They expect it to receive these kinds of protections, but there's a big gap and nobody really knows where it's going to go.
Oh, do we have some questions? Yes. I can't see it on my app. Would you mind reading it out? Sorry.
Can we do it the old-fashioned way?
Yeah.
We can hear you.
Oh, yeah, it was a study that women are adopting and using telehealth at like twice the rate of men. And so I just wondered, what are the ramifications of that? And like, do you think that's going to hold for other types of digital health kind of devices, options? I just wondered.
Well, probably because women really are the caregivers of the family too, right? So they drive all the decision truly, when you look at where healthcare is going and how you sell to healthcare, you sell to women because they take care of the entire family.
Just my personal experience, I have 4 children and my wife does it all, right? So she'll bundle all 4 of them at the same time, take them to the doctor's office to save that copay, right? And says, hey, doc, I got Jeremy here. You might as well do Brandon. You might as well do Bree. And,
They all get sick with the same thing at the
right,
same time
you know,
anyway.
you know,
She only wants to pay one copay.
exactly, right. And she only wants to make one trip, right?
Yeah.
So she bundled all 4 of them. So now with a virtual care, imagine her life. Oh my goodness, she loves it. And even now, we're empty nesters, but the virtual care is really the way to go for us. We just don't want to get out and take a shower and all that nonsense anymore, and get in a car. We don't want to drive, right? So for us, it works. I think when I was in Louisiana, it was interesting though that the demographics. There are certain groups of folks who want to come to the office because it's a social event. We bring out the cookies and all the snacks that we have in Louisiana, and it's a social, so they want to come, right? And so we cater for them. And so I think there's going to be a mixture of who uses. I don't know if it's women or men. I think it's going to be what's your situation? If you're a single parent and your father and you live in the East Coast, you want virtual care.
Well, the app marketplace is enormous now, right? And what you really find are a proliferation of applications that also include the telehealth capabilities by chronic disease, by certain certain prevention categories, very different areas. And I think that the women are really driving the app marketplace and some of the huge money that's going into the apps and also that are now being purchased by tech and by payers. Right now between payers and providers, that is not, they're now coming together, right? And the whole marketplace, when there's a good app, whether it's for behavioral health or whether it's for pregnancy apps, there are some really, really incredible apps. And I believe a lot of the market's been driven by women. And so I think that's an important thing to consider as we look at how our healthcare delivery system's going to change.
Did we have another question, Narisa, from the Q&A? Just John? Okay. That's,
Maybe that
Yeah.
explains why Loveless has a hospital dedicated to women's care. I just
Mm.
thought. Thanks, John.
It's your feeder system.
Yes, you know, from
Absolutely.
babies to breast care to everything that's,
Yeah,
it's,
yeah.
Mhm.
those service lines are very busy and,
Yeah.
yeah.
well, I want to get one last question in here and then we'll turn it on. I think we're actually running a little bit over, but I'm curious, we talked a lot about innovation and this is an entire paradigm shift. Do we think that this represents a lot of new opportunity for, say, new startups, new entrepreneurs, new health tech vendors? Or conversely, do we think that the compliance and the regulatory and the red tape, if you will, is actually more favorable to incumbents, even if their technology may not be as new and novel? And I'll open that up to anyone who has a strong opinion.
So I got, you know, I got some children who works in the consulting environment. In the first 6 months of 2021, venture capitalists spent $14.6 billion. If you annualize that, that's about 25 to $30 billion just in 2021 in this space. Last year they spent 14 million, so they doubled that. In 2019, they spent about 7 billion. So the funding is there, entrepreneurs are latching on to this. And I think that's why you're gonna see a lot more technology around this space. And I think understanding that women are the consumer, that's really good to know, right? I mean, that's good data, that's a good data point. But I think our young generation, here, what an opportunity for them to really make healthcare a better place, right? How to deliver healthcare in a way that's really transformative than we have before. You know, like wearing a wearables where you're out mowing your lawn and the thing says, hey, stop mowing your lawn, you know, sugar level is high, you need to take a break. That's not even virtual care, right? That's just like
Digital.
really, right? I mean, you're sitting down and you go, hey, Roy, you're sitting down too much. You need to get up and do 25 steps. That's spooky kind of care. You know, that's what I think is happening right now. We did it international when we had patients, we would give them a Fitbit, right, to take it home, and we would monitor hypertension and keep those patients out of the hospital. That's the idea, right?
Can you
so
see when
that's-
they snooze that alarm
Yeah.
to walk?
Well,
And disruption always means competitive pressures. And I think we're going to see some changes. And I think it is going to be, you know, it's going to be difficult for the smaller players to get in here. It shouldn't be. Technology is generally a leveler. I mean, the kinds of technology that's available, even at the consumer level, is amazing compared to what was available 5 years ago. So it shouldn't be a hurdle, but unfortunately, there's a lot of people set in their ways. I think this actually ties into the provider experience. We've talked a lot about the patient experience. A lot of what's holding up the small providers is the provider experience. Doctors aren't enjoying what's been set up for them. And we're in the smaller organizations, we're seeing some resistance to telehealth that concerns me greatly, because I agree with Julie that it's here to stay. But the organizations who aren't willing to embrace it, who aren't willing to make this transition, they will be the dinosaurs. And I regret that. I regret seeing some of the shakeouts that are going to happen, but that's always what happens, right? Constructive, what do they call it? Constructive,
Criticism.
no, constructive destruction. You know, it's going to be a shakeup.
You know, I think another way to answer that question too also is, I've tried to work with startups in our community and, you know, with blockchain and all these things, right? But, you know, healthcare in the end is highly regulated, compliance, risk, right? Legal ramifications of everything. So it's got to fit into our EHR, you know, and Epic, right? So the first question we're going to ask you is, are you in the app orchard? You're
Yeah,
not.
so
And that precludes a small player.
Yeah, so
Sometimes
but
by
in the
itself.
consumer side of things, I think the sky's the limit. Yeah.
so that's where I was going, Peter.
Okay.
We probably should end talking about interoperability, right? Because, you know, nationally, there are HIT regulations that came in, you know, they're the second iteration of the HIT regulations came in May of 2020. That's the Office of the National Coordinator 21st Century Cures Act. So if you're a new entrant to the marketplace, you may not have, be weighted down by some of the inefficiencies that we currently have in our healthcare environment, and we have a lot. But you will be required to meet the certification requirements like any other HIT vendor needs to. And those will continue to get stricter and stricter and more well-defined. And so the goal is for there to be efficient sharing of healthcare data. So all of us as consumers can have a complete and longitudinal record whenever we want it, wherever we want it. And for any provider we see to have access to that as well. So you don't have to call around. That is there's a national interoperability roadmap, I'll just say it that way, being developed. It's been underway for quite a number of years, but it's now going to make headway. So that is the key to our success, truly long-term. And there are some obstacles in terms of standardizing our data, in terms of how we share, so it means the same thing. But I think that's really big for all new entrants coming in to disrupt. And they're definitely going to disrupt.
I'm hopeful that that consumerization trend is going to disrupt some of the regulatory stuff that we're so accustomed to, because patients have a right to their data.
Yeah.
You own your data. You are entitled to it. You have a right to it. And we can't put restrictions on it the way we put restrictions on what doctors can do with it. Patients can take it and do whatever they want with it. And that's going to open some things up.
Well, we're already doing it with our finances, right?
Mhm.
We have our own bank account. We take care of our own money. Why can't we take care of our own health records? We're smart people. But anyhow, I think I was listening to Peter. I think the word, when I was reading for this panel discussion, digital literacy always pops up, for physicians, for patients. So it's going to be a learning curve for everyone to adopt this new technology. And I think telehealth might be the vehicle to disrupt healthcare, whether it be the Walmarts of the world or it be somebody unknown from some other place. But it's prime to happen.
Yeah, it'll force all of us to become more aware of how to effectively use technology, but it will do so also for our care team, and because it will really make, really change the training, right? I would think pretty quickly.
In a good way.
Yeah.
So what I'm hearing is COVID catalyzed digital transformation in healthcare.
Yeah, I think so.
Interesting. Well, I wish we could talk more. As always, you all are just amazing and fantastic. Thank you so much. If you have any questions for the group here, I think we're a few minutes over, but they'll be around. But thank you again so much. We really appreciated it and all your expertise.
Thanks, Stephanie.